Hello everybody, it's me Mr. Sibraj Lamsal speaking. Today my topic is about the CBT. CBT means the cognitive behavioral therapy. It is widely used in the effective approach to treating the anxiety, depression, OCD, stuttering, related anxiety and many other emotional challenges. So first thing is assessment and goal setting. What happens? You and the therapist discuss about your problems, symptoms, and goals. What type of problem you have, and what type of symptoms you have, and what are your goals. At first, you and your therapist will discuss about this. What is the purpose of this CBT therapy? Identifying negative patterns in thinking, behavior, and emotion. What type of negative patterns you have while you think and while you behave, and what type of emotion you have. That is the purpose. An example is, I want to feel less anxious or worried when speaking in public. It may be, example, I want to feel less worried, tense, nervous when speaking in public. So another thing is what, identifying the negative thoughts, cognitive distortion. If you think wrongly or negatively, then you may get problem. So all our problem is because we don't know how to think, what to think and how to think. What happens? You learn to stop automatic negative thoughts. Another thing is what, all or nothing thinking. Sometimes you say I am everything, I can do everything, and so sometimes you say I cannot do anything. It is the wrong. It is called the cognitive distortion. Nobody is perfect, so you should not think I'm all in all. Nobody is perfect in this life, in this earth. Another is I'm nothing. It is another thinking that people say I'm nothing because I cannot do this thing. So it is also the wrong. So another thing, catastrophizing means you, if something happens, if you get some failure, then you start to think my life is failure, all my life is failure. You may fail in any job interview, then you start to think my life is nothing, I failed in this interview. If you fail in one interview, it does not mean that it don't mean that your life is failure. Another is mind reading, how you read your mind or other minds. If other people's look at you, if other people don't look at you, then you start to think he ignore me. Mind reading. So it may be that he has some work, so he has not looked to you. Another is over generalization. Over generalization means you, if something happens to you, then you uh, add that thing to other things. Like if you don't get the job, then you start to think what my family say to me, what my wife say to me, what other people say me, how they look to me because I don't get job, and what happens to my future. Overgeneralization, you do overgeneralization, that is the more problem. And challenging and reframing thoughts, you have to challenge your thoughts. All whatever thoughts come in your mind, it may not be right, it may not be 100% right. So you have to challenge your thoughts. If your thoughts come, I will fail in this interview, then you have to say to yourself, even if I fail, I will go to another place for the job. So don't worry, even if I fail. In this way, you can challenge your own thoughts. Reframing thoughts, you have to reframe your thoughts. What happens? Your question irrational thoughts and replace them with a more balanced once thought, a record, seeds, or a Socratic questioning. You have to ask the question to yourself. And I replace I always fail with I have succeeded in many situations before. In this way, you can replace your thoughts. Another is what, behavioral activation or exposure therapy. What happens? Gradually face avoided situation or increase rewarding activities. Another is use for depressions by doing enjoyable tasks, anxiety or phobia step by step exposure. Example, slowly practicing the public speaking in safe setting. If you have fear to speak in the public, then you have to At first, you have to speak in front of the mirror in your house, then in front of your family members, in front of your relatives, in front of your close friends. In this way, you have to increase your self confidence slowly and gradually. So another thing is experimenting with the new behavior. It is called the behavioral experiments. So what happens? Test your beliefs through real life experiments. Example, if I speak up in a meeting, people will laugh at me. Try it and effects. So example, if I speak up in the meeting, people will laugh at me. So it is your thoughts. You can challenge your thoughts. If I speak in a slowly using the techniques, doing eye contacts, hand movements, and improving my body language, then I can talk very nicely. You have to think like this and you have to behave like this. So building the coping skills, you should build the coping skill. How can you cope that situation? Learn relaxation techniques, deep breathing, progressive muscle relaxation. Practice mindfulness, assertiveness, and problem solving skills. In the same way, homework and daily practice. You should given your therapist give you some homework to practice. If you have the if you are taking the CBT therapy, then your therapist give you some homework also and daily practice. They will give some homework. Like the CBT is a active therapy. You get assignment between the session. Tools include thought diaries. What type of thought you have to write in a diary. Exposure tasks, where you have to go for the exposure therapy. Journaling emotion and behavior, you have to journaling, you have to write your emotion and behaviors in a diary. Review and relapse prevention. Review at the end of the therapy, you have review what you have learned and develop a relapse prevention plan to maintain gains. It may be your problem may come again and again. It is called the relapse. So what to do when the problem come again? So your therapist will tell you about this and you have to do according to your therapist. Thank you very much for watching me. Please do subscribe my channel so that I will make much more video for you.